Hi everyone. So today I have fourth year med student, soon to be Dr. Sharma here with us, future IM, maybe HEMONC chief. So thanks, Harsh, for being part of this interview.
No problem. Thanks for
Mm.
having me.
Yeah. So yeah, crazy times right now with COVID. How is everything? Are you still in classes? Are you done with class completely, or how's that?
Yeah, so I think about 3 weeks ago, our school made the decision to completely switch us over to online courses.
Mhm.
So since then, we've just been, completing a set list of cases online instead of going in and doing rotations for the last 6 weeks of fourth year.
So are you guys doing like aquifer cases, or is it like Zoom, or what is it?
Yeah, aquifer.
Aquifer. Yeah. Okay. And do you have a couple more left, or are you going to be done soon?
I have a few left. I basically just click through them all, so I just have to formally do the rest of them.
Yeah. And then, so when I think I know I was talking to another internal medicine, like future internal medicine resident, a fourth year, and he was saying how he's starting like on like June 22nd, but then some people are saying theirs got moved up. Are you starting early or is it the same time?
I think ours is the 22nd or 23rd as well.
Okay. And you're doing IM in Arizona, right?
New
Or New
Mexico.
Mexico. Yeah, I got it. I
Yeah.
remembered.
Yeah.
Okay, so I just want to talk a little bit about kind of how you came to the decision of IM. It seemed like you knew pretty early on, actually, unless I'm mistaken, that you want to do IM and still playing on HEMONC or
Yeah. Still
yeah.
thinking hemonc. And last year it was funny because in May, my very last rotation of third year, I did my second general surgery month. And my
Mm,
first one was in December. And the preceptor I worked with didn't really inspire me to like explore the field seriously. But when I
okay.
did it in May, the surgeon and I got along really well. He was a good mentor and he kind of threw me for a loop and I ended up doing like a sub-IN surgery.
Oh, dang.
Almost I
Yeah.
liked the lifestyle,
Hmm.
like the lifestyle of IM a little bit more as far as like family oriented hours and all that, and also
Yeah.
just being able to transition my career a little bit towards I guess more, potentially being like a chief medical officer of a startup and working in the field still without like having a lot of clinical duties as my career like was on its second half.
Mm. Okay, so yeah, I just put up I guess an interview with another IM student who also had that similar thing where him and actually I actually had the same experience where we had good experiences with surgery. Seemed like you did too, and then we almost went into surgery, but then the lifestyle just didn't work out, unfortunately.
Yeah.
And then yeah, it seems like you also want to do more of like that CMO type deal, or maybe a consultant or something like that for a startup, or I don't know. That seems to be the new wave, maybe.
Yeah.
So what drew you to IM in particular, like, and HEMONC exactly? Was there like a
I
certain thing
think
that set you off, or was that just kind of like you thought it was like I feel like it's the heart of medicine. So is that you just went into that kind of you know naturally, or how did that play out?
I think before med school even started, the experiences I'd had as a scribe and then through AmeriCorps working at a clinic that was an internal medicine clinic for patients mainly over 60
Hmm.
inspired me because I saw that IM presented the opportunity just to really critically think about what's going on with the patient and work them up diagnostically. I
Hmm.
liked that you had a little bit of time to just think through some problems and just really like absorb a case without like, jumping into action right away, like in
Hmm.
surgery. You kind of have as you need to and see a patient's care through. And then with HEMONC specifically, as far as all the patient populations I've worked with, I think they're probably the most motivated patient population I've seen, and
Hmm.
they're the most likely to adhere to their medication regimens and keep their appointments. Which, as a physician, I think that is very rewarding to see the patients giving as much effort to their care as you are for them. So
Hmm. Yeah, that's one of the reasons why I was thinking of doing sports med, just because the population tends to be very motivated, especially working with athletes. They want to get sometimes they're maybe too motivated. They're just like, trying to get in before
yeah,
they even follow your recommendations, right? And they're pushing
right.
past things and stuff. So having that like kind of a joint effort where like the patient's on your side trying to work with you instead of like a lot of primary care. Unfortunately, the patient doesn't necessarily want to work through their or the best like treatment measures. They're trying to get like a pill to fix something and then just leave or address whatever's like painful or whatever.
Mhm.
Um, it's one of the like the main reasons I want to do sports med, but I don't know. I feel like there's still some some aspects of just general practice too that still appeal to me in some regards. So I feel like I'd want some of my clinic to be maybe general practice, but it is like you said. I think super rewarding to work with like highly motivated patient populations that are willing to work with you.
Mhm.
Why not family med?
Well, I guess less opportunities to specialize was the biggest thing, and
Yeah.
since oncology has been on my mind for a while, I feel like I could pursue the same avenues as a family physician, like if I wanted to be a generalist,
Mhm.
but have more avenues to go down the specialization route
Yeah.
with I.
Yeah, definitely. And since you did match IM, do you have any tips on matching for anyone else out there trying to match into IM? Do you recommend doing like research opportunities or other things like that? What projects were you involved in med school?
So last year, I did a poster on a patient that I'd come across during my hospitalist month. So got to publish and like present at our school's annual
Mhm.
conference. So that was one of the smaller like research things that I did, but that might have helped to just show interest in the field and develop it. And then even from undergrad, I'd had some publications through the lab I worked in. So as far as research goes, those were probably the highlights. And then I also presented a different poster at the American College of Osteopathic Internists annual conference in
Mhm.
Orlando the year before. So that was also a nice thing to have presented at the National IM conference, just for I guess namesake when it comes to applications. And other than that, I would say research your schools and programs really well. Most programs have very thorough websites as far as like board requirements, resident testimonials. You kind of get a breakdown of like how many are DOs versus MDs versus IMGs, and you get a mix. If that's important to you, or if you want to see like if you are a DO and you don't know if they've ever taken any, or if they take a low number, it helps you narrow down the list. And also location's important. Where do you see yourself wanting to be for 3 to 3 years at least? You want to be in an area that you can enjoy when you're free.
Mhm. Okay, and I guess we didn't mention that you go to an osteopathic school, kind of in. Do you want to say what area of the U.S.?
Yeah, in Kansas City, Missouri.
Okay, so yeah, so do you feel that there was any bias against you when applying to residencies at all, or not really?
Not so much. Of all the places I applied to, like I had done research beforehand,
Mhm.
and I don't think my list would have changed substantially. But I know like University of Michigan, for example, is like exclusively MD heavy, and probably
Mm,
some of the bigger research institutions out there, and
yeah.
including like ones in Boston, probably UCSF and things. But when I
Mm,
applied, I think having taken like the step exams in addition to Comlex
mhm,
made it a pretty open game.
mhm. And do you feel that's more like IM versus like other specialties? Do you feel like other ones, like maybe subspecialties, would be a little bit more challenging to get into, or do you feel it's pretty even now, or in terms of trying to get in even?
I feel like it's mostly even, but I think in general, the ones that are most competitive for MD applicants
Mhm,
holds true for DOs. Like neurosurgery and derm come to mind. I think those, no matter what
yeah.
applicant you are, it's going to be almost impossible. So I think those fields are definitely have more of a barrier, but all the others I think have relatively evened out.
Mhm. Okay, and then also, you mentioned that you took step exams in addition to Comlex, right?
Mhm.
Do you think that still would be an important thing for maybe like DO students trying to get into competitive programs to do, or is it not really necessary?
I think it's necessary, and it
Mm,
was interesting because this this year was obviously the first year of the DOMD merger as far as residency goes, and
mhm,
it's interesting because like throughout our 4 years of medical school, our deans and faculty kept saying like the merger is going to be a very positive thing for DO applicants. It's going to make things much more, I guess, equal playing field where
mhm,
they even encouraged you only taking Comlex and not the step exams.
mhm,
But now that we've had like match data just from our school and looking at like what the NRMP's published, it sounds like the merger probably hurt DO candidates more so than helped, because it seems like a lot of applicants kind of fell a little lower on their match rank list because some programs that maybe historically took MDs but now had like DOs like entering the field didn't necessarily like take warmly to them. So I'd say taking both would like increase your chances of matching it like a traditionally ACGME program if that's what you want.
Mhm. And, also, I guess there's some, recent big news, right? Got engaged?
Yep. Yeah. Got engaged last Sunday.
So congrats on that, man. That's I
Thank you.
remember talking about stuff like that, in undergrad and stuff, on walks and things like that, so that's pretty big news. In regards to, you did a couples match, right?
Mhm.
And, how was that process like?
Uh,
Like, is it just like a thing you click off on, when you're applying, or how do you have to?
it was, it is stressful. Yeah. Yeah. So it's like an extra $25 to like match as a couple. When you
Mm,
apply through the NRMP website to register for the match, um, that's all you have to do. And then when you're going down your rank list, you basically each create a list individually. So like for us, like if number one was New Mexico, we would both put that. Number two, we would do Arizona, and
mhm,
so on and so forth. So technically, you're still submitting individual lists, but then
mm,
when the algorithm runs it, it makes sure you both match at that same ladder. If not, it moves down to the next one.
mhm. And do you feel like it increases your chance of getting into a spot, or do you feel like it doesn't really, make a difference, or maybe makes it, more challenging, or is it more beneficial, like, if one applicant has, like, a really high stat to boost the other one up? How do you feel, it kinda plays out?
Yeah, I think it one depends on the specialty a lot. I think with like for me, I am, and then my fiance pediatrics. Like that's a relatively good combo because we're both primary care specialties that have a lot of different programs throughout the nation. But like if someone was doing like a dermatology and IM like couples match or something, I think it could be more difficult if the dermatology isn't as highly sought after as far as being a strong applicant, but the IM
Mhm.
applicant stronger.
Yeah.
I think you would want whoever's applying for the more competitive specialty to be more competitive, obviously. So then the couple
Mhm.
has a higher chance. But I
Yeah.
think for us, it worked out pretty well. Like sometimes if she got an interview invite, but I hadn't heard from that program, I would email them. And then within a few days, they would invite me as well. So I
Mhm.
think they looked favorably upon us, which was fortunate.
Mhm. And how was the interview experience in general? Like, do you have any tips on doing well in interviews? How many interviews to try to schedule? Like, I know the last person I talked to mentioned that he had like I think it was like 40 interviews lined up or something. He thought that was like way too many. He would have, you know, cut back
Yeah.
a lot if, or he would have applied to even less programs if he'd known he'd gotten so many interview invites back. So how many would you recommend applying to? How many maybe interviews do you recommend having set up? And any tips on doing well in interviews?
Yeah. I would say, depending on the specialty you're going for and the numbers that are out there as far as matching based on like step one scores and all that, for IM, around 30 if you're not couples matching is a good number.
Mhm,
The general rule of thumb is like however many programs you plan to apply to, if you're couples matching, at around 10 to give you a little bit more cushion.
mhm,
I know like surgery programs, maybe like 40 is a good number just because it's more competitive and so on and so forth. I think ortho average applies to like 80 programs just because it's so competitive. So it depends on the specialty as far as like how many, but for IM, I'd say around 30 is a healthy number. I would aim for 10 interviews. And one strategy to do is if, let's say, you interview at a place or you get an invite at a place that's very low on your list, you're expecting a lot more, but it's still early in the season, you could schedule that one for like December or January, which is the end of the interview cycle. So if by that point you've already gotten 10 others that are much more, that you're much more interested in, then you could cancel that one that would have been the 11th that you're not as excited about. And then as far as like when it comes to actually interviewing, it's nice because once you have the interview invite, it's relatively relaxed. You'll have dinner with the residents the night before. It really is casual, laid back. They're there to answer your questions and give their experiences about the residency program, and just really want to, it's a chance for you to see like how are their personalities meshing with mine, how well challenged do they feel in residency? Do they look burned out? Do they look happy? All those things. How well do they talk amongst each other? Are they cordial, or are they kind of like off to themselves when it comes to talking to their co-residents? And then the interview day, it's usually just two one-on-one interviews that are 20 minutes each. So the actual interview portion is very short, and the rest of it is just like presentations by the program director, tours and stuff. So the day goes by very quickly, and most of the time they don't even talk about anything medical. It's more about like where
Mhm.
you're from, what you like, and just seeing if you're a good fit for the program. So it's not
So it's not really like, med school like interviewing for med schools where they're kinda grilling you, where it's like MMI, high stress. It's more laid back, getting to know each other type of deal.
definitely, yeah. The playing field's much more evened out by now.
Mhm. And then, you'd recommend going to, like, the pre, interview day dinners and kinda getting to know the residents and things like that, or
I'd say so. Obviously, they're voluntary, but
Mhm,
especially if it's a program that you're maybe 50-50 on, like you applied, but you don't know too much about it, I think the dinners are a good like litmus test to see just how well you might fit there. But if it's your number one program and you would go there in a heartbeat anyway, maybe you don't have to go. But even then, like sometimes programs that you think highly of like might not be as great in person versus on paper.
mhm.
So interview dinners are always a good way to just see if you'd be a good fit at the program.
Yeah. And so, after you submitted, ERAS, did you end up contacting programs that you were, like, really interested in, like, expressing your, desire to go there, doing anything like that, or did you just kinda wait for a reply?
So I had even before submitting ERAS, I'd like personalized 5 personal statements for the programs I was very interested in, and I just wrote, like I just added a one-liner at somewhere in the personal statement being like, "Oh, like, this experience I've done matches really well with your program's, like,
Mhm.
emphasis on community service kind of thing." So that was one thing
Yeah.
that I did um, that helped me, like, I guess, stand out or do a little bit more for the programs I was highly sought seeking. But after submitting ERAS, I didn't send any letter of interest emails unless my fiance had gotten an interview invite, and then I sent one because of that reason.
Mhm. Okay. And, in terms of scheduling, you recommend scheduling, um, I think it seems like most people try to, like, schedule either based on, like, geography, like, kind of batch them all together, or then, like, some if I guess if it's important, you'd schedule it earlier on. Any tips on scheduling interviews or and also the interview cycle starts, October-ish or when?
Hmm. Yeah, I'd say the earliest would be like mid to late October, and then the bulk of them will be November and December, and then tail off after that. So, as far as scheduling goes, it's really hard to do it geographically. Like, if like 3 interview invites come in like a week, and they're all in like one part of the country, then obviously you can try to schedule it. But for me, it was very haphazard as far as like the locations. So for the most part, I would just schedule them based on available, like what your calendar is currently. Because
Mhm,
for me, I ended up averaging like one interview a week, which worked out really well.
mhm,
But if you have two one week and it's next week, but you get one from a program you care about, it doesn't matter when in the interview season you interview from the data I've read. So
mhm,
like, don't push yourself to front load your interview season just because you think it's better to do it earlier versus later.
mhm. Yeah, that sounds like good advice. I remember, reading about some students who, like, they scheduled, like, 5 interviews in, like, a week or, like, it's like every day was, like, a different interview at a different place, and that just seems like, super stressful.
Right? And then you can't go to
Yeah.
the dinners for sure, and you kind of miss
Yeah.
out on
Mhm.
things.
Yeah, so, spreading it out, I guess, I think once a week sounds reasonable. You can, like, kinda relax, prepare, and then go to the dinner like you're saying, then recover afterwards,
Right.
and then, get ready for the next one. Plus, like, some schools, like, they aren't as forgiving with, like, taking time off for your rotations. And if you can't take time off your interview season, then you end up having to miss days and make up days, and sometimes like your rotations could get like jeopardized in terms of earning units or whatever if you miss too many days too. So spreading it out, I guess, especially if it doesn't affect your results, seems like a good idea.
Right.
Um, okay, so those are some interview tips, and we talked about ERAS a little bit. Um, And I guess on the topic of since couples matching was something that we talked about, how is it like dealing with relationships in med school? And then I know we talked about relationship stuff before med school a little bit. Do you recommend having like a medical partner? Because some people seem to think that it could be beneficial because you can share experiences and like commiserate on things like that. But sometimes it seems like it could also be hard for you to like distance yourself from medicine. So, how's like the dynamics of like being in a medical partner relationship, and do you recommend it? And well, obviously, and then
I'm biased.
a little bit, and then how do you kind of recommend maneuvering around maybe a relationship in med school or even residency? How are you preparing for that? Since it is very like um, time requiring. I don't know the word. It's very time demanding. What are your thoughts on that?
Yeah, I think the biggest thing comes down to obviously like what your partner is like, and obviously like as you're together during your med school years, you kind of get a gauge for not only their personality, like in the classroom and like as a medical professional, but like their personality outside of it and who they were before they joined medical school. So I would look for, how compatible are you guys just based on what you do in your free time. Can you completely disconnect and just enjoy an evening off together and have a great night, like watching a movie you guys have been meaning to see, or going out and enjoying a new restaurant? And I think it speaks to the strength of the relationship if you can kind of tune it out as much as possible. Obviously, it's not 100% doable. Like you guys are obviously like in the same class or maybe like one class above or below each other. So like med school talk's going to seep in just because, it's a big part of your life. But I think just keeping an eye out um, for how well your relationship works outside of just the field of medicine itself, as far as like what your hobbies are, what your families are like, and the personal values you have that just extend beyond your professional careers. And then I think one of the biggest pros, obviously, is like since you're both so time constrained, then you you both understand that, maybe instead of having like 5 or 6 nights, like, the other partner isn't, questioning anything, or like not as happy because they think, you're not devoting your time to them. So I think moving forward in residency, it'll be good to hopefully coordinate our calendars and like once we have our schedules for the month, just pick like 1 or 2 nights at least a month that we'll commit to just having it be just the two of us, and kind of go from there so the relationship gets the time it needs.
Mhm. Okay. And then that's good relationship advice. And you mentioned taking time off for things like movies and food and things like that. I remember back in the day, I used to read a lot too. How's it been able to? How have you been able to keep up with your hobbies, like being in a relationship and being in med school? And what kind of things have you been doing? Is it mostly just like that kind of time with like eating out and movies and things, or are you still able to do other things as well?
hmm Yeah, that's a good question. I guess some of my biggest hobbies the last few years have been exercising. So I've been lifting, still using the regimen you outlined for me about
Monday.
3 or 4 years ago now. So that's been good. And then I've also been lap swimming for cardio, and that's
Nice.
been nice.
Yeah.
On top of that, also, I do like reading, and I got a Kindle a few years ago.
Mhm.
Reading on there. So usually before bed, for with the quarantine recently and just shelter in place, there's been a lot more free time. So I picked up a
Mhm.
few additional hobbies. I'm learning to draw and just been looking up a lot of YouTube tutorials and stuff. And that's been a fun hobby, as well as just writing regularly, because, we've talked about me wanting to follow Gawande's footsteps and hopefully, be a good writer. And I think those are both good skills to have between art and writing. I think it helps you communicate clearly, and I think it's something that might make me a stronger resident too, as far as just being able to disconnect from the work life. So those are some of the things I enjoy, and I think when it's a normal medical school, like rigorous schedule and time is limited, obviously, like, you kind of pick like 1 or 2 things in a week that you would really like to do. Like if exercise pretty important to me, so I think even in my busiest rotations, I was able to get to the gym at least once or twice a week. But maybe I didn't read because I was reading a lot for school. So there's trade offs, but you're just played by the week. And then once you have like a more chill rotation, like peds or psych or something, then you can kind of engage your hobbies more fully.
Mhm. Yeah, it sounds like a good plan, and definitely true. Like, I feel like even in third year, a lot of times you don't have time, like you mentioned, for all your hobbies or a lot of things that you want to do, or maybe not even being able to do them as long as you want to, even if you pick like one or two hobbies. But getting that in even a little bit does a lot for like even your mental health and like stability overall, I feel. So yeah, that's really important. Um, right now, since COVID's upon us and we're in quarantine and all that, how are you preparing, or are you worried about being an intern in a couple months, or what's kind of like the setup? Do you know if they're going to let residents work in on the front lines and at your hospital, or how's that working out?
Yeah, I think, first of all, I think one of the craziest things is just how surreal like the pandemic has been as far as like
Mhm.
being a fourth year medical student. Obviously, like as far as all the different years of training that like it could have happened, and I think fourth year is relatively a fine time for it to be happening because obviously most of our requirements are already done, so we're not losing out on like, you know, quality of rotations or anything like that. But at the same time, our graduation is canceled and it's going to be virtual, so it kind of takes away from the accomplishment from the last few years, and also even before that in med school, everything you've worked for without having like as much of a like all encompassing event. So I think it'll be surreal to start as an intern and just have had like a 3 4 month gap from fourth year to intern without kind of too much of a transition. If you I would say. um, but what I have been doing is I have a list of the most common IM inpatient workups. So I've been, once a day going through like different up to date articles for each case and just working up things like hyponatremia, DKA, pancreatitis, etc. So that's helped keep me busy. And I'm not sure what our hospital is planning to do as far as front lines or what the first few months will look like or anything like that. They haven't communicated too much. I think our schedules will come out in the next week or so, so we'll see. But it's interesting dealing with like this long like quiet period in our training where I'm sure a lot of people, maybe not be reading up and will take intern year head on when it comes, which is also a good strategy. But
Mhm.
I like being prepared a little bit, so I've been taking notes and just doing a little bit here and there to stay refreshed.
Yeah, it seems like strategies seem to be pretty split. There's like on one side people that are just like take it off completely. It's going to be hard regardless, and it's going to be like your last time to relax. And then other people are like maybe study like a little bit so you don't forget stuff. I know people have said they've already forgotten most of med school already in their fourth year.
Yeah.
Everything is like flushed out, right? But I like personally, I feel like just because I tend to be more of like a anxious person, I'll be like, oh, maybe I should prep a little bit. So maybe I'll try that strategy that you're saying. You said you usually go over one pathology, like one major disease process a day.
Yeah, up to date's pretty good because they'll have like management of blank. So then, it's maybe takes me like an hour, hour and a half to get through that article, write down the major bullet points. But that way, at least you have a framework. And like one thing I've read just online on Reddit as far as efficiency when it comes to being a resident, which I thought was a really useful piece of advice was, and I've talked about Evernote before with you, but this one resident basically recommended to have an Evernote note per pathology. So like every time you see a patient and you learn something about that pathology's workup, you can refer to your Evernote before you go see the patient to see what's already on there, and then like keep a running list of that pathology. So like by the time you're second half of intern year, second year, third year, you're just building a rich like self-created document as far as what to do when you come across something, and it just keeps you learning all the time and gives you your own reference instead of, I guess, looking at other texts which you might not remember as well.
Mhm. Yeah, that's great advice. Like one of the on peds, I was working with two family med residents, and one of the third year family med residents, she's like brilliant, and um, she always had her Evernote thing opened up on her phone, and she like if we discussed any pathologies, she'd like pull up articles. She'd be like, "Oh yeah, I have an article about that," and like at this time, and then she'd like be like scrolling through her Evernote, tabs on her phone. And when I thought of that, I don't know if I messaged you about it or not, but regardless, yeah, it reminded me of you and your Evernote note taking. So I think it is really helpful. At least I don't know, the sample size is limited, but she seemed like she was really on top of everything. And she could remember like random facts from different days, and part of that could be because she, or from different articles. Just because part of that could be because she had, maybe done multiple passes through different material and kind of like incorporated that into her like knowledge framework through things like making her own notes and kind of building new information into like her framework, like on Evernote and in her brain. So that seems like
Right.
a really good idea that maybe I'll have to start. I've been using OneNote. It's a little bit somewhat rough around the edges a little bit. Maybe Evernote's better. I don't know. Or maybe I just need to start doing it. But I've been lazy. So I guess after sub-I's and aways, I might start doing that. Have you,
Hmm.
have you been using Anki or anything like that? Online Med intern videos or anything like that? Or no?
I use Donkey for the step exams, but I don't think I'm going to use it moving forward or like online med or anything for
Mm.
residency. I know time's much more limited. So basically, whenever I do have some time, like between like patients or anything, I'll probably just be doing like the mix app question based for internal medicine boards and kind of just do solely questions as like residency
Mhm.
progresses.
And so yeah, I've heard about the was it Mix app on Reddit a little bit. Do you want to explain what that is and what kind of study resources maybe people would tend to recommend in residency? I mean, of course, you haven't gone through it yet, but you've obviously been researching, techniques and stuff to do that. So do you want to kind of explain a little bit about that resource?
Yeah. Yeah, sure. So MixApp is basically it's like UWorld plus first aid for internal medicine residency, and each residency board has their own version of these exams or like this testing software where basically it's a huge queue bank of questions that'll prepare you for your residency boards at the end of those 3, 4, 5 years, whatever it may be. And it also does come with like a set of physical books, and most residency programs will have paid for your subscription beforehand. So when residency starts, you get the physical set of books that you can read through, and then you have, however many thousand questions. And the plan is basically for you to, before you take your boards, go through all those questions, and then also just augment your clinical learning with that source. So I think as far as like resources that I've heard residents recommend, it seems like that is the be all end all. Like for internal medicine, it would be mixed app, and that's basically it. Because, like I said, there's limited time, so there's not time to like supplement it with things like Anki or online med and different kinds of like learning modalities. So that's my
Mhm.
plan.
Yeah, so the Mix app and then just up to date then, huh?
Hmm.
Yeah, it's pretty crazy how, like, I mean, as med students, I feel like you're expected to have like a general idea of maybe medications that you might want to consider. Sometimes they'll ask you about dosages, but not so much. But then when you're an intern or like a resident, you have to know like peep settings and like all kinds of random like facts that, actually make a difference in patients' like care. And you have to know that to like a very high level and, very specific details. So that's kind of scary personally, I think. Um, I guess you'll be as an
I
intern,
agree.
maybe it's even expected that you're just always like asking nurses for help and maybe your senior residents or things like that. But it's pretty scary, At least I thought.
Yeah, it's scary, and it's also humbling because obviously like the moment you step into your intern year, everyone knows that you're the least experienced
Yeah.
person as far as like one that's finally getting paid to do something.
Mhm.
And I heard like a good curbsiders podcast the other day about like how to survive intern year, and one thing they said was to own your newness to the field, because no other time in your like paid training will you be like as little experience as you are as an intern. So you're gonna, like you want to learn as much from nurses and techs and faculty and residents as much as you can.
Yeah.
And I feel like one of the things that makes it less scary as far as knowing all the different, details is after like the third month of inpatient rotation, like just doing by repetition will pay off in the long run. I think as med students, we're expected to like perfect like one rotation after 3, 4 weeks, but then we move on to surgery and completely forget IM. So I think it'll be nice to have a bridged learning experience where we're not like forced to like forget everything we know about one thing and then relearn the next month.
Yeah. And then you mentioned the Curbsiders podcast. Is that main podcast you usually like to listen in on, or are there other podcasts that you recommend?
Uh, as far as medical ones go, I think Curbsiders is pretty great, for both. I think like I am Family Med, and probably some of the other ones, some of the other specialties out there, just because it's pretty broad. It covers a lot of good pathology, and it's kind of all encompassing as far as podcasts go.
Hmm. Okay. And since kind of on the topic of podcasts and information we consume, since you are a big reader, what are some of your top book recommendations off the top of your head?
That's that's tough. I'm reading Zen and the Art of Motorcycle Management right now. I've been meaning to read that for a really long time. I really like it. It's the story of this guy who writes first person view, and it's him, his son, and two close friends on a motorcycle trip going westward. And just his style of writing and the way it flows is really great, and kind of just a introspection of kind of like the Eastern philosophies as far as religion and incorporating that into more of Western culture beliefs. So that's a good one. All-time favorites include Cutting for Stone, Emperor of All Maladies, um, House of God. I didn't like as much as people like had built it up to be. I thought it was an okay book, but I don't know if it's just outdated now or what. But um, let's see. Those are some of the ones that come to mind. I also liked Dune a lot, which is like a sci-fi book.
Mhm. Okay. And since you mentioned Dr. Gowande, and obviously we're both big fans, and wanting to be a writer, what kind of prompted you to be or want to become a writer? And what are your kind of future aspirations with writing and the impact that you want to have with it?
I think an inspiration's been seeing how effective of a modality it can be and kind of conveying what you hold most true and what you value. I think sometimes, you kind of get lost in your day-to-day activities as a clinician, and you might not have energy to, I guess, make more lasting changes past just beyond your personal clinic or the city you work in. But I think with writing, if it's done effectively, I'd like to maybe work on a more like national scale, and you know promote changes medically through Congress or just through media that can affect change for like clinicians everywhere instead of just in my more like local surrounding area. So I think that would be one way to take it. And I think it's also, I think writing in general is a good like therapeutic exercise for personal reasons, just because you can hash out what you went through in a day or a week, and kind of self-reflect and grow from that.
Hmm. Yeah, so I guess it has that therapeutic value of parsing through your emotions and thoughts, and then also it's a way for you to have like a larger scale impact. So in regards to that, you'll do that along with your career. You mentioned that you wanted to maybe be like a CMO of a startup or something, right?
Yeah.
What are kind of like your overall like grander career ambitions?
Well, I think, hopefully if I get into HEMONC, and if that's something I'm
Yeah.
still interested in, hopefully, then I'd like to ideally practice as an oncologist for 15 to 20 years or so before transitioning as a CMO. And I think that would have like a twofold purpose where I would, be able to get a really good mastery of like the clinical operations of being an oncologist, but then translate that into, once I have, I guess, the experience of being an oncologist, translate it into what I think is lacking in the field, and targeting a startup that I think can transform the field even further or take it to the next step. And I think that would kind of be my aspirations as far as how I would want to start and end my career.
Okay, so that'll be long term. I thought you were saying that you wanted to like finish your fellowship and then like work for a startup,
Oh, no, no.
but this is you're going to try to practice clinically for a while, and then after that, maybe when I guess a lot of doctors start getting like burned out even like after a while of after practicing for like decades of medicine. So maybe around that time period, as you get older, you like transition into that kind of sphere when you have that experience built up.
Right. And especially I think as a CMO, I know like just seniority in general, like the
Yeah.
older you are, the more likely you are to be
Mhm.
like hired as a CMO, just because now you finally do have the experience and the
Yeah.
gray hair. some people say.
Mhm,
So I think that plays a big role in it.
mhm. Yeah, because like I know like some schools, I think like Stanford medicine, I think a lot of their class ends up like not actually practicing medicine because they end up going to like startups like right away. But I think there's
Mm,
some value in trying to first build up your clinical experience first, so then you actually have that background. You can have more of like that direct change where you know all the nuts and bolts of like whatever you're trying to deal with in that startup or with patients in general. I feel like you understand them a lot better if you've had that at least few years of clinical experience before. Almost like Elon Musk, right? He actually works with like the fine details of engineering at like Tesla and these other places, whereas like some of these other like CEOs or CMOs or whatever, I don't even know what position he is. Some of them tend to just like make administrative changes, but they don't have that like fine understanding of like at the ground level, right? So I think that's one of the frustrations with like admins in hospitals, even now with like the PPE issue and all that stuff, is that they're often making recommendations based on like random metrics, and they don't have an understanding of what like a lot of these doctors or nurses or other healthcare providers have to go through, and the risk that they're putting a lot of these healthcare professionals in because they haven't actually, a lot of these admins in hospitals are like MBAs without clinical experience, even um, or other types of admins even if they don't have an MBA. So I think having that background has like a multitude of effects where you can either get involved in like the fine details of that startup or whatever business you're trying to do, or it can even just help you understand like what the people that are doing that kind of stuff are going through. So yeah, it sounds like a solid plan, man. Once you get
thank
become a hemong chief.
That's the goal.
Okay, so uh, kind of taking a step back into OMM a little bit. Since you already matched, I guess maybe you can be a little bit more open with this stuff. How? Because I know like some people say that they never use OMM after they've practiced it, especially in certain fields. I've heard some people still use it. Like one student I was talking to, I think one doctor that they shadowed like used OMM a lot, especially in his family med practice, and he might have been like a sports med doc too. How useful do you feel that OMM is in practice? I'm sure it's probably more specialty dependent. And do you feel yourself using it in the future or not really?
Yeah, like you said, I think it is very specialty dependent, and I guess that family med and PM&R are probably the two main specialties where, if you do graduate as a DO, then those would be the fields you would use it most heavily in.
Mhm.
Um, I don't see myself using it like on patients too much. I think it is useful like just when I am with some of my DO friends and like my back hurts or vice versa. Like it's nice to treat each other just
Yeah.
because it's in an informal setting, and one of the big things is like as an internal medicine resident, like most patients are going to be inpatient. They're going to have a lot of like IVs and tubes and things
Mhm.
where like more than half the OMM treatments have to have the patient on their stomach or like in certain positions. And most scenarios, whether you're even outpatient clinic as an internal medicine resident, you have like 15 minutes to see each patient or 30 minutes, and you're going through their history and like managing medicine. So I think it doesn't set you up well to do like both OMM and medical treatment. But I think like family med and PM&R docs, especially if they can block out time for it and do it exclusively, then there is a lot of benefit to patients. I did a family med rotation with a doctor that did OMM on basically every patient, and they came to him, every other week for that reason. So it has merits, but I think it definitely depends on the specialty.
Mhm. And then in terms of types, there's like is it like 6 or 7 branches, or is that right? It's like MSK, lymphatics, and different things like that. I don't know this at all, so you could.
Yeah. Yeah. Now that I think about it, like cranial is a big one, and then musculoskeletal, lymphatics. What else? I feel like those are probably the three big ones, honestly,
Mhm.
just because musculoskeletal like encompasses so many, and then there's different techniques like high velocity, low amplitude versus soft tissue techniques and all that. So there's a lot of different modalities even within the big branches.
And could you briefly explain? Because like a lot of us, even me, I don't really know super well how, like what exactly OMM is, osteopathic manipulative medicine. So you're obviously manipulating things. How exactly do these procedures kind of work? Is it like kind of like a chiropractic type of deal where you're like like realigning bones and things, or is it like you're using different tools, or how does that work out?
Yeah. Well, our school like strongly suggests us not like compare it to chiropractors because they're
I'm sorry who I pissed off.
no,
No,
you're good.
I know there's like a lot of hate to chiropractors, and especially in the sphere. Sorry, so I apologize to you and everyone else.
No, no,
All
you're
the
fine.
all
I
the
don't I
DO
don't think it's a big deal because like I think, people compare to that and like massage kind of. And
yeah.
I think the the overall principle of OMM is that, the body works as a full unit, and,
Mhm,
you know, one part that might be not functioning at normal like physiological capacity um, could be because there are other parts of the body that are also not working well. So, like, let's say you have right knee pain, it could be because one leg is a little longer than the other. It could be that, your lumbar spine, when you palpate the transverse processes, there's like a preference for like a few of the lumbar vertebrae to rotate one way or the other. So, like, that could be affecting your knee pain. So, I
mhm,
think one of the nice things is to kind of step back and see, okay, you have knee pain, like, is it because of something that happened there? Is it a trauma, or is it a different part of the body that's contributing to that issue? So I think the biggest thing is OMM allows you to do a head to toe evaluation where you're checking, from the cervical to the sacral vertebra, checking for any like somatic dysfunctions where like, you know, or like either like in the vertebra or like ribs are displaced, or you're like when it comes to sinus problems, like it could be because your lymph isn't like being circulated properly. So it gives you an additional tool to treat patient and like find the underlying cause in addition to using medicines.
mhm. Okay, so and what type of procedures or things do you do exactly? Like, is it like shifting muscles? Is it more like massaging type? Sorry, I'm not sure who I'm offending now, but
No, no. So yeah, so I'd say the main like procedures or like ways to treat people are like soft tissue technique is basically when you're working on an affected area, let's say like the thoracic spine, you feel like, some of the vertebra are like rotating one way versus the other when you're palpating on the transverse process. So you kind of like apply like a soft pressure, and you move the tissue in like all directions and see like which way it prefers to rotate. So like you move it up and down, and then clockwise, counterclockwise, left and right, and you hold it in a position of like against the position of ease. So then you feel the tissue kind of loosen up and kind of become more like movable in all directions. So that would be one technique. You can also do HVLA, high velocity low amplitude, where you isolate a couple vertebra along the spine, or like wrist or elbow or knee, and you just provide like a high, as described, high velocity low amplitude force, where you're just like giving a perpendicular force, so that when you reevaluate that spine, or whatever part of the body you're working on, the range of motion is back to normal. So those are two main ones, and then there's a few different like cranial techniques. Cranial is probably the most out there and like not well researched and like not backed up. So that's kind of a weird one where I don't even know like what cranial technique is. But I'd say HVLA and soft tissue techniques are some of the main ones that you employ. Yeah.
Mhm. Okay, and do you have any maybe any regrets or suggestions about going to like a osteopathic program? Like, would you have gone into taken another year to go into like an MD program, or would you have uh, chosen differently based on your experience now, or do you feel like this was like a solid experience and you value kind of the experience that you had and you wouldn't change a thing?
Well, maybe somewhere in the middle. Like I think it has been a solid experience overall, and I'm pretty happy with how match worked out, and the career trajectory that I think I'm headed on. I think DO School provided the necessary resources to get me there.
Mhm,
I'd say one thing is, I think a lot of students do fall in the trap of like only wanting to go to an MD school, and they keep like pushing back their application like year after year and keep getting turned down, and like are really chasing like that rabbit. And I think if that's the main reason, just the distinction, I wouldn't recommend it. I think DO schools are, right on par with MDs as far as like being able to get you into most specialties, maybe like some of the more competitive and research requiring ones, like neurosurgery or ortho, like obviously I think you'd have a hard chance as an MD. But I think one interesting thing is now that step one is pass no pass and step two might follow suit. I think it'll be I'm curious to see what the main factors that residencies like will use to pick people to interview now, because I would predict that the focus is going to shift onto research, and if that's the case, then I think MD students would have an advantage unless DO schools started like shifting gears and like making their research departments much stronger. So I think I've been pretty happy with my decision, but I think moving forward, I'm not sure how like step one changing and maybe step two changing will affect how competitive DO applicants are.
Mhm. Do you feel like DO schools have a little bit less of a rigorous, research focus than MD schools?
I think so. Most might have a research department and like, have PhDs working on things, but it doesn't seem nearly as robust as far as like from what I've heard from like our MD counterparts in most MD schools, just because it seems like MD institutions are kind of tied to much larger like research organizations, whereas I think like a lot of the work that like our research department does, it seems like not as, I guess, like not as robust. So I think that is one thing that holds them back as far as research goes.
So it's more, maybe focused on, like, clinical practice as opposed to things like research or other, more, more, I guess, research focused as some students might kind of want their career to go.
Yeah,
Mhm. But, I guess if you hadn't gone, to your school, you wouldn't have met your wife, right? Your fiancé.
that's true.
So,
Yeah.
no regrets there, right?
Nope.
Yeah. So, any big changes in medicine that you're excited about over the next few decades? I remember you were involved in. Was it you that was involved in the augmetics thing?
I'd thought about joining, but I didn't.
Mhm. So, I mean, obviously, you're still interested in tech and like kind of like the new advances in medicine. Is there anything big things that you're kind of excited about or interested in, or ways that you see medicine going in the future in the next few decades or so?
Uh, I think the biggest thing, like as far as advancements go, like CAR T cell therapy jumps to mind, just because when it comes to cancer, I think that's been a game changer, and also like some of the like CDK treatments, like cyclin dependent kinase treatments that are out for cancers now. That's one field, obviously, that like I look into more than others as far as developments go. And it sounds like there's a lot of promising new therapies that even the oncologist I worked with during my third year said, like some of the cancers that he saw as a like oncology fellow that were like almost impossible to treat, now in clinic he can treat them with one or two different like therapies. So I think that's a really promising field that's going to grow. And I think in general, like as tech gets more embedded in hospitals and, even like Dragon technology, I feel like is changing the game as far as like time saved for providers and helping with burnout. So hopefully there's more employee, like employee favored technologies that like make their day better and allow them to spend more time with patients as opposed to doing paperwork.
Mhm. Yeah, the big advancements in like cancer kind of treatment modalities seems like a pretty exciting field. Is that what you're trying to get into in terms of startups, or is it something different?
Uh, I'm not sure yet. I guess it would depend on like, how the clinical years would it evolve and what I would like, I guess, identify as like shortages in the field.
Yeah, I guess plus also like you're planning on doing that in like 10, 20 years, and the healthcare field could be completely different by then
Right.
with the way things are changing. Yeah, I was talking to one of the doctors about Dragon, and it's interesting because like nowadays I feel like our like iPhones could like transcribe things pretty well. So I don't know if Dragon's gonna be out of business in a little bit.
You're right. I mean, I like dictate my text all the time and it catches like 90% of the stuff. So
Yeah.
you're right. It might not be needed.
Yeah, we'll see. Maybe we need to invest in Apple stock or something.
Yeah. It's a good time for it.
Yeah. Well, although I guess right now with like the quarantine, it's kind of hard to tell what you know what's the best with stocks and stuff. It's kind of like unstable right now, but I don't know. We'll see. How are you planning on preparing like financially for like your residency years and afterwards? Do you have like a financial plan, or are you just kind of doing it as it goes, kind of relaxing and letting things fall in place, or how's your strategy right now?
Yeah, no, that's a good question. And I think one of the nice things about fourth year in general, like especially once interviews are done, is you get a chance to explore your different options out there as far as like how you're going to tackle loans and
Mhm.
what the game plan's going to be. One resource I'd recommend for anyone listening is Ben White. He's currently, I think, a resident in radiology, and he's got a great website. I think I'd used his website when I was studying for step exams because he just talked about the philosophy of taking a standardized exam like that and like the importance of just like continuing to move through it instead of like emotionally investing in questions and so on. But he actually just came out with a like free like 100+ page PDF about how to deal with loans, especially for like people in the field of medicine. And it goes through the different repayment options, like, you know, pay as you earn versus repay versus forbearance and like the pros and cons of each. So I think anyone in any situation, like in med school, like should look at that because that was helpful for me as far as my personal financial plan. I am going to go through repay for my residency and hopefully fellowship years because it just takes off a bunch of the interest in the government, matches your payments, and like forgives a lot of the principal. Or the interest. So that's really nice. And then once I'm out of fellowship for the next 3 to 5 years, I'm planning to, you know, continue to live like a resident and just pay off the rest of my debt en masse at that point. So that's my way, but I would definitely recommend checking out Ben White's website because
Mhm.
that PDF's great and you know it's free and it's really nice that he has that resource out there for med students and
Yeah.
professionals.
Yeah, I know some people recommend things like White Coat Investor and other ones like that. And you said Ben White. Is it benwhite.com or is it something else?
I think if you Google Ben White, like his website will show up, but it
Yeah.
probably is benwhite.com.
Yeah.
He was featured in a White Coat Investor podcast, so like
Mhm.
he does have the backing.
Mhm. For sure. And then there's also like Fire, something. I forget. There's
Yeah,
like,
physician on file.
yeah, yeah, exactly. Mhm. Yeah, I remember reading them like I think early on in med school, and then afterwards, I don't know, maybe I just like got too depressed thinking about that stuff, and I was like, okay, I'll focus on like other things. But maybe fourth year, I'll go back to it when it actually seems like, oh, we're gonna start making money again soon. Probably should think about stuff. But I guess also for you, it's helpful that you and your fiance are both in medicine. So once you guys finish residency, you know, you'll have a nice income stream.
Yeah, yeah, that'll be nice. I think it'll give us a chance to just start saving a huge amount like once
Mhm.
student loans are paid off and hopefully investing in different things like you know
Yeah,
whether it's housing or you know other solid investments and while
yeah,
also saving a lot.
yeah. Investing in a house with a white picket fence, two dogs, and two kids.
That's right, the dream.
A good old American dream.
Yeah,
Is she planning on doing fellowships too, or?
yeah, I think she is leaning towards maybe like PICU or NICU at this point.
Hmm, that's pretty intense, isn't it? Or Nikki?
Yeah, it is.
But I guess it's probably rewarding, like saving lives, and that's
Hmm.
that's more acute, and then you'll be more on like you know, the chronic side, right? So you guys are like on
Yeah,
the side of the field.
definitely.
If you do IM and a HEMONC fellowship, are you um, able to work with kids, or is that like a different specialty? Is it like peds onc or something?
Yeah, I think you have to go through pediatrics residency to do peds hemonc, so it would be exclusively 18 and older.
Oh, so that's interesting because like it seems like once you're like so specialized, you should be able to work with like kids too. But then also like I heard a lot of these peds fellowships, even if they're like comparable, they end up earning less.
Yeah. Yeah,
Yeah,
I don't know how that works, but I think compared to like a outpatient pediatrician, like
yeah,
specialists end up making a little bit less. But I also think I think a lot of that is like where in the nation you're practicing, and then also like
mm,
what other credentials you have. You know, I think like my fiance did like the bioethics like master's program too. So I think
yeah,
just having that like on board should hopefully like you know boost salary, and also like obviously if you're like if that's what you want to do, then I think
mm,
the dollar amount doesn't really like
mhm,
matter as much. I
yeah.
guess.
Plus, I mean, I guess ultimately you're making a good income regardless, right?
Right.
Uh, you're just trying to think of like ways you can maximize it or things like that. Do you end up deciding on a spot you want to live in? area of the US?
Uh, not not yet. I think it's difficult just because we're from each side of the country with
Yeah.
like the Bay Area and like the DC area. So I guess that's something that'll evolve, and we'll see how New Mexico is and go from there. But
Mhm.
I feel like hopefully, like for me personally, I liked Salt Lake City a lot. I like
Mhm.
Seattle, Portland, Denver. So those are like some of my top areas.
Yeah. It's interesting because like well, I guess also, you just have to apply for fellowships too, right? Would you try to do a fellowship in, New Mexico too, or would you is there a couples fellowship match?
I'm not sure if there is. I think there might be. I know there's not too many PEDS fellowships in New Mex in at like University of New Mexico. So like if she does do that, we might have to like go somewhere else.
Mhm. Yeah, it might be rough. How long is fellowship for, HEMONC?
3 years.
Years? Dang, that's almost like surgery level, training.
I know it.
Plus 3, yeah.
And if I do like a I am chief resident year, then that would be 7.
Oh, so for IM, you're not chief for your 3rd year, you have to, stay for another year for chief?
It depends. I think at most academic centers, you end up like staying on like as a fourth year. I think at some of the more community programs, like all third years are automatically chief, so there's like
Yeah.
a distinction there. But I think in general, at like universities, you do stay for the extra year.
Yeah, so then, what would be the benefit of doing a chief year? Is it just helping you get a
Yeah.
scholarship or what is it?
Yeah, I know. Like one, it does like increase your competitiveness for fellowship, and two, like if you're interested at all in either like administration or teaching leadership, like those are the three big things that you get to develop. Obviously, because at that point you're not like as involved in a clinical day to day, but you're kind of like managing like your 3 years of your intern like resident class and working with program leadership and kind of being the middleman between like them and your residents. So if you're interested in those things, then it would be beneficial
Mhm.
from what I've heard.
Okay, and when we were talking about fellowships, I forgot to ask a little bit about, med school, like your study strategies. I remember back in undergrad, you used to be very methodical with how you approached like studying and organizing things and everything. Um, what
Mhm.
what techniques did you use in med school, in your first 2 years, and then also in, your clinical years, in your 3rd years and your 4th year that you found helpful? What kind of resources did you like using? How do you schedule, like, your studying, and what techniques do you find to be the most effective since from undergrad to med school from undergrad to med school, obviously, there's gonna be different resources you use, but then I feel like sometimes there's also different techniques that you use as you become like a better student and maybe not maybe you had everything that you needed in undergrad but how do you kind of approach things?
Yeah, I think for me, the biggest thing during the first 2 years was like it's nice because like compared to undergrad, you kind of still have lecture packets and kind of like a structured like material to study from. That's your like primary source of studying. So as far as like however many lectures that let's say like your neurology midterm has, I still liked to divide that up like starting like 5 days before an exam, just like go through like each lecture packet, and then leading up to that Saturday or Sunday before a Monday exam, like I would save those last few days for practice exams and like reviewing the highlights of all of those packets instead of like being involved in the nitty gritty. Because I think in med school, obviously, like practice questions play a big part. And maybe if I had to go back, like I would do even more practice questions or maybe try to like get through a whole like Q bank, whether it's like USMLE, RX, or Kaplan, or just one of the ones that isn't UWorlds to like beef up like my question game. So I'd say like that's a pretty good strategy first 2 years, and then like going into the clinical years, obviously you have less time. So I think between Anki and UWorld alone, like those are two good resources. And if you have time, like you can read up to date articles on like the big pathologies. Just because I've heard from some people that like that does pay off for step two. But I think yeah, Anki and UWorld are good for clinical years.
So you weren't really a fan of video resources like Pathoma, Sketchy, Online Meta, things like that, or no?
Not so much online method. I didn't touch too much. I liked Sketchy for the first 2 years. That was good. And then I mean I watched Pathoma, but I just felt like like I got more use out of doing like Anki for step one versus like doing Pathoma just because it sunk in more.
And for sketchy, did you like a particular one of their subjects? Like I for me, I found I've talked about this before on my channel, but I found micro to be the most useful, farm to be somewhat useful, path to be like the least useful, maybe targeted. And now I think they even have like clinical year subjects too, which I would find like a little bit too many to remember, just like so many different like sketches. But what
Mhm.
were your thoughts on which ones were the most high yield or beneficial?
Yeah, I think I agree. I think like micro is definitely the best. I think farm is a close second though, just because like especially when it comes to like cancer drugs or just some drugs that just have like a lot going on as far as like very specific like mechanisms of action. It helps distinguish them. I'd say those two are the best. I didn't really touch path, sketchy path much, so I can't say how that one is.
Mhm. Yeah, I just feel like after a while, like, they started blending together and there's so many to remember, it's like, it was nice, like, especially micro, I felt was super helpful. Like, I
Mhm.
still like, sometimes, like, people ask me or, like, in clinics, they ask me, like, random facts or random things come up, and I'm like, "Oh, yeah, that was gram negative, it was, like, whatever, fermenting or whatever," just because like, I remember, like, that, like, milk carton in, like, that one sketch or whatever, you know?
Yeah,
So it was really helpful, but like I said, after, like, a couple sketch like, after, like, 100, 200 sketches or whatever, after a while, they start just, like, blending together, I'm like sometimes I have to look up, like, the name and sketch on, like, Google Images or whatever to just remember,
mhm.
like, what the picture was, and then I remember, like, the details, you know? So it's like, even remembering what picture it was gets difficult sometimes,
I agree. Yeah.
yeah, so they start blending together, but, I feel like it was super helpful, and I think it was worth it while it lasted. A little pricey, but, you know, I mean, I guess if you paid for it, it was a little pricey.
Yeah, I'm not gonna comment on the legality of my methods.
Yeah, it's funny how, like, it's not really spoken about that much, but, if you're a pre-med, watching this or I guess even med students, there's a lot of resources that are shared, PDF resources, video resources, and stuff among classes, which is why it's important to, know your classmates, build up good relationships and connections and things like that. Which actually reminds me, did you, your class, how big is your class? It's a little bit bigger, right?
Yeah, it's around 260.
Mhm. Oh, I guess that's not that big. There's some classes I heard that's like 500 and stuff, or even like Caribbean schools are like, Caribbean schools are just like huge, right?
Yeah.
Did you find it was hard to connect with people in your class, or do you feel like it was easy, or were there like different activities that brought you guys together? Because I know like some schools are like really small, especially if like you're like a newer school, you might have like 60 kids or something, sometimes 90 kids, 100 kids. But then, some schools have like 200, some schools have 500 or even more if you're like a Caribbean school, for example. How did you feel like the dynamics were at your school?
I thought overall it was relatively easy to socialize, and I think the personalities kind of like separated themselves as far as like there was like a huge chunk of like people who already had kids, so like you didn't see them too much other than like
Yeah,
required like activities on campus, obviously, but like the ones who were still like single or like newly in relationships, like you kind of like found like your group no matter how big like the class was. So it was nice to know like everyone that was kind of on the same boat as you are, like get close with them as a subset, and then like still get along well with everyone else but just not like hang out with them as much.
yeah. Any advice for pre-meds on getting into med school?
uh I mean, I don't know if it's still true. I think like obviously GPA and MCAT are probably still the two big things, and then like a couple letters of rec and things, but I'm not sure if it's changed. I don't know if like they're looking for research more now, or like what the main like extracurriculars are. Maybe some research through like a lab that you work at would be
Yeah.
nice. But yeah, I'd say those are the big things as far as like when I was applying.
Any advice for new med students, maybe newly admitted ones? I'm not sure how the COVID thing's affecting them, but what would you recommend to like a new med student who just admitted or like a first year on taking the most advantage out of their med school years and doing well?
Yeah, I'd say one of the biggest things is probably to like start understanding like your classes like conceptually as quickly as possible. I know like there's a lot of details and a lot of things that like you feel like you have to memorize, and sure, like that's fine. But as far as like just like coming up with analogies that you can relate to and coming up with things that you can like draw a concept back very quickly will help you like going into not only your first year 2 year exams but also like in the clinic, like to be able to draw something just based on like personal anecdotes, I think like plays a huge factor. And then I'd say probably the two big things are like to start like the Zonky like step one packet like right away, just because like, you know, it's 20,000 plus cards, but like it really is high yield and leads to good scores. And then also like doing a question bank as you progress through your first 2 years, whether it's like Kaplan or USMLE like RX or something, just so like you get a bunch of questions in before you take step.
Yes, so you recommend starting, Anki, like, right away, even early in your first year?
Right, like whatever subject you're doing, like if you start with biochem, start doing the biochem deck and then
Yeah.
keep going basically.
Yeah, I think one of, like, the, higher up admins at our orientation even, he was telling us, I don't know if it's a cultural thing, this probably sounds maybe racist, but, he's, like, one of those, like, foreign Asian, elderly Asian, doctors who was just, like, telling us to, like, start studying for a step even before our first week of med school, which is, like, really funny.
Oh my god, that's too much.
But, yeah, I mean, there are people that, like, start, even trying to prep before, but, personally, I think maybe waiting till unless you're, like, really weak in a subject, I think waiting till, like, med school just starts and just, like, dealing with it then, would probably be the best, if you're, like, a newly admitted med student, maybe brushing up on some big topics if you're, like, really weak, but if you're, like, a solid student, I feel like you could probably just take the summer off before. I don't know, maybe that's my opinion.
I No, I agree. I think you don't have to do like anything like before like day one of med school, just
Yeah.
because you know you're gonna learn like you have pass no pass. I don't
Mhm.
even know now that I think about it, like if doing Zonky is even worth it, you know, for step one,
Mhm.
if you just need a minimum score and
Yeah, yeah, that's true. Because the whole change. Yeah, it's gonna be weird to see in that. Sometimes, like, you don't even
yeah,
notice the effects till, like, a couple years after when they've studied, the people that have gone through and then notice the changes, so it might be, like, a couple of like, weird years. Plus, again, with that COVID thing right now, I'm not sure how that's affecting, like, AMCAs and interviews and all that stuff.
yeah,
Um, Because like, yeah, I mean, that's gonna be rough trying to, like, figure everything out, especially
yeah,
with online stuff, yeah.
even like sub I's for you. I was wondering like, you know, like our
Yeah.
school's gonna offer rotations for in the fall.
Yeah, I'm not sure, like, right now I'm actually, fortunately, 'cause I 'cause I took one of my rotations, my IM rotation at the end of my official 3rd year, the year I took off. Luckily,
Yeah.
I'm actually officially done with 3rd year now. So, thanks. And so, I have, like, a month to prep for step 2. They haven't told me anything about, like, if Prometric's gonna be open even,
Mhm.
in May, but I'm hoping it opens up 'cause or else I don't know, my whole schedule's gonna be messed up. Because 'cause I'm supposed to take step 2 CK, then CS, then I'm supposed to, do my, I actually have an elective and then a sub-I, so it's gonna be, like, back to back, and I'm trying to get, like, letters in and stuff. Um did you schedule step 2? I forgot to ask, I don't know if is there a call next step 2 CKCS or no?
Yeah, there is.
Okay, so did you schedule, step 2 CKCS or Comlex CKCS or whatever it is, like, together, or did you spread them apart? How do you schedule those?
Yeah, I spread them apart just because like our school makes us eligible to take the CS version
Mhm.
like as of April like first of your third year.
Yeah.
So I took that on like April 3rd, just to get it out of the way, and then like took step like CK in June.
Oh, so you took it after your CS.
Yeah,
Mm. Okay, yeah, because I heard you don't need too much prep for CS, right? Like, I heard you
right.
read the first aid, book real quick, a couple days before maybe, and you're good?
Yeah.
Yeah, and then you took, I'm assuming step 1, like, right after or, you did after, like, a dedicated period in after, your 2nd year, right?
Well, interestingly, so like I'd taken Comlex after my second year, but like
No.
I
Oh,
wasn't doing well on the practice tests for like the
mm,
step version. So like I actually took step one after a month after my step two. Um,
Dang.
so
Yeah,
I took both like the complex step two,
yeah.
the actual step two, and like in June of last year, and then I took step one a month later in July. So I did like all three of like the big boards in the summer.
Oh, that's sounds rough, but
It was hard. I was really done by like by the time I finished step one. I was like, okay.
yeah. How was, the material different in step 2, versus step 1 for the clinical knowledge type of, side of things?
Yeah, I think it's like obviously a lot more management heavy. So it's not as much recall about like specific like physiological facts or pathology as much as like incorporating that. In general, there were the passages were much longer. So like you had to sort through a lot more like clinical data.
Mhm.
And there's also some like research style questions where like I think maybe like 6 to 7 research questions total. So like you have like a long like research like a long abstract or whatever with a graph and different data, and then you have to interpret like on a 3 step question.
Yeah.
So I think in general just knowing your management decisions really well, and
Mhm.
just knowing kind of the different algorithms as far as like, okay, what's the first step, like if they've done this, only then would I move on to doing this type of imaging or ordering this test. So I think
Yeah.
that would probably be the biggest like advice, just know like how to manage like the big conditions
Mhm.
very well.
Chest pain, heart problems.
Chest, yeah,
What are
like
some
chest, like cardio and lung,
Yeah.
cardio and pulm are obviously hugely represented, and I think there was a surprising amount of OB as well, from what I remember.
Mhm. Yeah, I heard some people, looking up, like, ACOG stuff, for, like, OB-GYN before, OB-GYN and thinking that was helpful. CBP is, like, one of my worst areas, but, it's so important though, for,
It
like,
is.
anything. So, I don't know, I probably have to, like, I don't know, maybe do extra questions in that or, like, I don't know, check if there's, like, a Najib video or, like, Pathoma, I don't know, some kind of video so I could, review that stuff. And EKGs too, EKGs I'm, like, horrible at.
Yeah,
So
EKGs on the step exam itself, they're like very straightforward, so I wouldn't worry too much about that.
yeah, like AFib or something,
Yeah,
A4.
AFib, MI.
Yeah. Basic stuff. Okay, so, I guess we're kind of, getting close to the end. It's almost 5:30 surprisingly. Um, and I don't wanna keep you too long. I'm sorry if it's, too late. But I was wondering, do you have any regrets about going into medical school? Would you have, still done it knowing what you did now? Or, do you have any, maybe like a different career that you would have tried? Or and also, is there any advice for it seems like everyone goes into like undergrad or like half the people do, especially, maybe if you come from like an Asian type or immigrant type background, uh, with like that whole like, "Oh, I'm gonna be a doctor" type of mentality. Do you have any advice for them also? And then again, do you have any regrets about your career or anything else you'd like to do?
Yeah, I think to start off, I don't have any regrets, and I'm pretty happy with having gone through med school. And
Yeah,
just over the last few weeks, I feel pretty excited that I like finally get to be an intern. I know like obviously it is like a scary time as well, as far as like transitioning from just being a student into like having full on responsibilities. But like for me, it's finally a chance to, I don't know, like own my learning and finally like apply myself to some extent. And I think about Kobe a lot, and like
yeah,
how like how like leading up to this point, like we've obviously like been pursuing medicine, but like I said, with rotations, like every month you're switching gears, or like in the first 2 years you're like trying to balance a bunch of things between like studying but also doing research but also doing extracurriculars. So I think like once intern year hits and onwards, you're like exclusively dedicated to the craft of like practicing medicine. So I'm really excited to like, I guess, even hone in more so on the practice.
mhm,
And as far as like what you said about like people, like even growing up and like not knowing exactly like what they want to do, and like by default like wanting to be pre-med, one podcast I'd heard that gave a really good advice was to explore the field that you want to be in, like as like, I guess, as detailed as possible. I think there was a basketball example where like this athlete's son got to like shadow this like obscure like title within the field of basketball, but like loved it. It was like more management based versus like being on the court and stuff, but like they fell in love with like that aspect of basketball. So I would say like if you're interested in medicine, like explore like all the avenues as much as possible. The younger you are, like the more time you have to shadow like techs and nurses and like doctors and just like different specialists within the field of like medicine, just because it's not, physician or bust. So I would just, I guess, make a really thorough decision and like shadow as much as I could to hone in on like what exactly about medicine I loved and try to do it that way.
Yeah, I think that's great advice because sometimes like your niche could be like a PA or like an NP or something, and maybe that, or even like a respiratory therapist or like a physical therapist or whatever, maybe that like vibes with like your lifestyle, your interests, and all these things more. But then you're fixated on becoming that MD or DO that like maybe you end up regretting some of the decisions that you have, or maybe not fitting in as best as you would have. And a lot of doctors actually regret going into med school and becoming a doctor or whatever, just because like maybe it wasn't the fit, maybe they had other influences, other things like that, or maybe they didn't realize the realities of like how the practice was going to be. So I think also getting that early exposure with like shadowing or whatever, if you can, which can sometimes be hard, is really beneficial, like you said. And then once you get in, like going 100%, right, Mamba mentality,
That's
and
right.
making it happen. Yeah, dude, it was super sad hearing. It's pretty crazy. Like sometimes I still think about it, and it kind of like shocks me.
I know, because like all the COVID stuff started happening, so it like, obviously like dulled that news or
Yeah,
just like shifted the focus.
yeah, yeah. 2020 has been pretty crazy. Like it's, like it was supposed to be like the big year that everything like nice happened, and
I
it's just
know.
been like super downhill. But yeah, you're right. I forgot about that because like COVID and the quarantine, and then people like actively dying, and people just being like super afraid. It's crazy how like so quickly like all the shelves in like stores just like empty, and then like everyone outside are wearing like masks, and
Yeah. Like I never thought we'd live through something like this. It's just so
yeah,
surreal and like nothing like we've
yeah,
ever lived through.
yeah. It's almost like a modern day plague type of deal. I mean, not as bad, but
Right.
it's pretty intense. Then even with our modern tech and our modern like patterns of like healthcare and administration and stuff, it seemed like we as a country especially responded pretty poorly to it,
Yeah.
um, administratively, and then also like even in terms of like we talked about this a little bit earlier, like admins in hospitals, like there's like a lot of like controversy right now with like PPE in hospitals and making healthcare workers have to reuse things and maybe not even giving them access, and then admins getting doctors fired even or in trouble for reporting like or even bringing up to the public like issues with PPE, um, personal protective equipment, right?
Yeah.
For those watching, if they don't know what I'm talking about. But yeah, man, it's really intense right now, and I don't know how the rest of 2020 is going to be. Hopefully, it's not going to keep going downhill.
I hope not.
It's not like an asteroid hit us or something.
Yeah.
But yeah, well, hopefully this year turns around. I'm excited for you guys to start, intern year soon. It seems like you're stoked about it, and it's gonna be rough, but I think it's gonna be like a large formative period where we really become, well, especially you, and then me next year, hopefully, we really become like these healthcare professionals, these doctors, finally, even though we've had all this training, but a lot of it so far has been kind of like learning the language of medicine and just kind of learning how medicine generally works. But then now is like where we actually become like real like healthcare professionals, real doctors who are diagnosing things and making important decisions like in real time, and actually like having big impacts on patients' lives. So this should be an interesting, exciting time. Hope you stay safe out there when you start intern year.
Thanks, man. Yeah, it was good to talk
Yeah.
through like the med school experience and like catch up and stuff.
So thank you guys so much for watching. If you like this video, make sure you like, comment, subscribe, hit that notification bell for me. Make sure to write any comments down below if you have any suggestions for other videos, if you like the video, if you didn't like the video, or if you have anything to say about any other parts. And yeah, thank you again so much for watching. I hope you guys have a good rest of your day. Take care.